Hi, my name is Liz Mort, and I'm the Senior Vice President for Quality and Safety at Mass General and MGPO, and I'm here with Dr. David Hooper, the Chief of Infection Control at MGH. And we're here today to talk to you about flu vaccines. David, what's new this year?
Well, Liz, this year we're at MGH are going to make flu vaccination of all our employees a requirement. And the reason for this is that, in fact, flu vaccine is the very most effective way to reduce the risk of flu transmission. That transmission could be to patients, it could be to your colleagues, or it could be to your other family members. And part of the reason for this is that flu virus, in fact, spreads before you have symptoms. So you could easily transmit to another person, be that a patient or a colleague, without knowing that you were doing so. And so it's important that we reduce the likelihood of this, and MGH is committed to doing everything we can to provide the greatest safety and protection for our patients. And it also reduces the likelihood of people getting sick from the flu and being out of work, so you can work harder.
So this year the flu vaccine is required for people who work at Mass General. Last year, David, we gave people the option of pledging to wear a mask when they came within a certain distance of patients. Why aren't we giving that option, and why is the vaccine itself required this year? Help us understand that.
Well, I think the use of the mask policy was an alternative, but was clearly not as effective as flu vaccine. First off, a mask you're not going to be wearing out in the community where you might be exposed to flu when you're not at work. And so the vaccine is much more protective that way. And it's awkward to wear during work. And it's very difficult to make sure that people are complying with that practice, every time that they have interactions with patients. So it's just simpler, it's more effective to have the vaccine than the mask.
And I think, thank you, David. I think that's important because many MGH employees last year opted for that. And as David pointed out, it's actually hard to remember to do it every time. And obviously wearing a mask with patient care doesn't give you any protection when you're not wearing the mask when you're out and about. And this is about our employees' health as well as our patients' health. So this year, the flu vaccine is required. So when is it going to be available? How do we get our flu vaccines this year? We're all eager to do that, David.
Well, they're available now. You'll get this bright pink sticker after you've gotten your flu vaccine. You can get it in Ock Health at the moment, and then there are going to be flu vaccine clinics under the tents where it'll make it very easy. So I strongly encourage you to do that first opportunity. At any time you can arrange to go to Ock Health to get it done, but you won't have to go far. And there are going to be champions on the floors that actually can
for peer vaccinations.
Peer vaccinations as well.
David, I forgot to ask you a question before we moved on to availability of the vaccine, which is, what about for people who have medical reasons or religious concerns about the vaccine?
Right.
Is there a process for exemptions?
Yes, there is a process for two categories of exemptions, a medical exemption or a deeply held religious belief exemption. There are forms that are available that you have to fill out, and documentation for medical exemptions from a physician that are then managed by Occupational Health and Human Resources. And those persons who have those exemptions that are approved will be expected to wear the N95 mask when they are, the regular mask when they are involved in patient care as the alternative, given they won't be able to get vaccinated like the rest of us.
Thanks, David. So required is different than last year because you will not be able to opt to wear the mask, but you still, as an MGH employee, have the right to request consideration for exemption of the two types David outlined. And we will be rolling out timelines for when we want to see the exemptions filed for consideration, and when we want to see people get vaccinated so that we get the workforce vaccinated in plenty of time to keep our workforce safe and our patients safe alike.
We have plenty of vaccine, so why wait? And it's free.
And I haven't yet received my vaccine. David went to Occ Health to get his, but clearly the yellow will not be an acceptable color to have on your badge. Once the deadline for being vaccinated happens, that's going to be November 15th. And this year the color that we want to see on everybody's badge is pink. So thanks for your attention.
Thank you.